Second white coat. Subscribe and like. Let's learn medicine together.
Let's dive into a really fascinating medical mystery. It's a story all about how one of the body's own protective systems can fail, turning the most ordinary, everyday sounds into a source of, well, excruciating pain.
So it all starts with a 33-year-old patient. He walks into a clinic and he's got this very strange complaint. He says that for the last few weeks, the most normal sounds have become just unbearable. I mean, can you imagine? The gentle clink of dishes suddenly sounds like a car crash. A door closing sounds like a gunshot. That's the world he's living in now.
So to really understand what's happening to him, we first have to put a name to this bizarre and honestly pretty distressing experience.
The official term for this is hyperacusis. And let's be clear, it's not that his hearing has gotten better or that he has super hearing, it's that his tolerance for sound has just totally plummeted. Normal sounds are perceived as painfully loud, and it's forcing him to avoid just about any public place. So what on earth is going on inside his head?
To find our answer, we have to become detectives. We've got to investigate the scene of the crime. And that means we're taking a journey deep inside the human ear.
And here it is, the middle ear. This is our crime scene. So sound first hits the eardrum. You see it over there on the left, the tympanic membrane. That vibration then gets passed along this incredible little chain of 3 tiny bones, the malleus, the incus, and the stapes. This delicate piece of machinery is exactly where our investigation has to begin.
You know, in a healthy ear, hearing is basically a 4-step mechanical process. Sound hits the eardrum, right? It vibrates. Those vibrations travel along that chain of tiny bones. The final bone, the stapes, pushes on this little doorway called the oval window. And this creates waves in the fluid of the inner ear, or the cochlea, which is how our brain finally registers sound. It seems pretty straightforward, but here's the thing. There's a crucial safety feature built right into the system.
Think of the middle ear like a VIP lounge, and every good VIP lounge has its own security team. Well, the ear has 2 tiny little muscles that act as bodyguards, and their whole job is to protect the delicate inner ear from sounds that are just too loud.
And this brings us to our 2 main suspects, these bodyguard muscles. First, you've got the tensor tympani, which tenses up the eardrum. Then you have the stapedius, which pulls on that stapes bone to dampen loud vibrations. But here's the crucial clue. They report to different bosses. The tensor tympani is controlled by the trigeminal nerve, while the stapedius is controlled by the facial nerve, okay? Remember that detail, because it is the key to this whole case. So, keeping our patient's symptoms in mind, it's time to trace this problem back to its source. We need to figure out exactly which part of this delicate system has failed. All right, let's start by eliminating some suspects. First up, the eardrum itself. The patient shows no signs of a rupture, no perforation, so we can clear it. The eardrum is not our problem. Okay, next, what about the tiny bones? Well, a problem there would usually cause hearing loss, which is the total opposite of our patient's extreme sensitivity. So, nope, we can rule them out too.
This brings us right back to our bodyguards, and all the evidence is pointing to one of them basically being off-duty, specifically the stapedius muscle. It's paralyzed. It's just not doing its job of pulling back on the stapes bone to dampen sound.
But hang on, a muscle doesn't just decide to stop working, right? Something has to tell it to stop. So the real question here is, why is it paralyzed?
And the answer lies one step further back in the chain. See, the problem isn't the muscle, it's the nerve that's supposed to be giving it orders. The true culprit is some kind of damage, what doctors would call a lesion on the facial nerve. Now, this kind of nerve injury can be caused by anything really, from a viral infection to inflammation. But because of this damage, the command to contract is being interrupted. It just never reaches the muscle.
And this makes perfect sense, because the facial nerve is a master multitasker. I mean, it's not just in charge of that one tiny little muscle in the ear. It also controls your facial expressions, manages your tear and saliva glands, and it even handles taste for the front of your tongue. This explains why a problem with this one single nerve can cause such a wide array of symptoms that seem totally unrelated.
And here's the clinical proof. You've probably heard of Bell's palsy, right? It's a condition that causes sudden facial paralysis. Well, patients with Bell's palsy are suffering from an issue with this exact nerve. And guess what? They very often report hyperacusis right alongside their facial droop. This is why that clue about the 2 different nerves was so important. If the trigeminal nerve were the issue, we'd be looking for a completely different set of symptoms. The hyperacusis points us directly to the facial nerve. It all just clicks into place.
So, now we have all the clues. We've identified our culprit. We've understood its methods. Let's put it all together and state our final diagnosis, connecting every single dot.
The chain of events is crystal clear. It starts with an injury to the facial nerve. That leads to the paralysis of the stapedius muscle. Without its bodyguard, the stapes bone vibrates uncontrollably in response to sound. This, in turn, amplifies sound transmission to the inner ear, and the result is the patient's debilitating hyperacusis. It's like a line of dominoes falling, one after another.
So the crucial point to take away from all this is simple. The patient hasn't developed superhearing. His auditory system is just unprotected. It's like the volume knob on the entire world has been cranked all the way up and he has no way to turn it down because that internal safety mechanism has been completely disabled.
And this whole case just leaves us with a fascinating thought, doesn't it? It shows how a single nerve can link our ability to hear comfortably with our ability to smile. It really makes you wonder, what other surprising, intricate connections like this are hidden deep inside our body's complex wiring?